So what we're going to talk about tonight here is prolonged recovery from concussion, predicting it, preventing it, and a program for management. And one of the reasons we're going to talk about prolonged recovery is, well, short recoveries are the rule usually with concussion. And the way to treat a concussion and the way to approach a concussion is to look at it as really no different than you would with the cold or the flu. Unfortunately, the issue seems to be more with teenagers and maybe preteens than any other age group. About 75% of the time in teens they have a short recovery, but that means 25% of the time they do not. It's nice to be a young adult. Young adults recover about 90% of the time within about 2 weeks without anything being done for them, as long as things are managed properly. So why would somebody be among the 25% in particular among school-age children? Well, if they've got a history for migraine headaches or dizziness, if they were knocked out at the time of their concussion for more than 1 minute, you may find it interesting that a brief loss of consciousness and immediate vomiting right after the concussion actually seem to be protective and predict a shorter recovery. If the individual's noise or light sensitive after the concussion, that predicts a longer recovery. If they're having sleep disruption, longer recovery. Cognitive deficits right out of the gate, longer recovery. Irritability and other mood or personality changes also predict a longer recovery. Staying in the game after you get hurt really predicts a longer recovery. We see that all the time in our clinic, where the story is the young man or young woman comes in, they were injured in the first quarter, and they didn't tell anybody. And they may not tell anybody until the next practice, where they start to feel poorly at the next practice. They don't even tell anybody the next day, right after the injury. Or they may not tell anybody until the next game, days later, where they get hit again, and now they're really feeling awful. So that staying in the game, and that was backed up by research done at the University of Pittsburgh in 2003, really slows down recovery. And it is state law now that once we suspect a recovery, that you need to stay out of the game, sit out of practice for at least 24 hours. Getting a second concussion before you've recovered from the first predicts a long recovery. Unfortunately, a previous concussion within the last 12 months predicts a longer recovery. Cognitive exertion, talked about that a little earlier. If people are having trouble with thinking and they're forced to exert themselves cognitively, study, take tests, do things that take a lot of brain power, slows down recovery, especially right out of the gate. Somebody who's getting concussions more and more frequently, or concussions that take less force each time they get one, or people who take longer each time to recover, that predicts a prolonged recovery. And then too much physical exertion too soon also predicts a longer recovery. Of course, one of our biggest problems is underreporting. The athlete's not telling us about their concussion. Although sports-related concussion appears fairly common, we're reading about it all the time in the newspaper, seeing it on TV. How many watched the Steelers-Bengals game, saw the last play of the game? The last play from scrimmage ended with a concussion. Antonio Brown was knocked out. Contrary to what the Bengals are saying, he did not fake it. He went limp in midair. You can't fake that. And there was a reaction he made with his arms that you can't fake. He had what we call a piano player's response, where his head and neck went limp, and his legs went limp, and his arms went rigid. He had a concussion. Even when they do recognize a concussion, they're reluctant to report it. How many watched that HBO Real Sports, now it's 3 years ago, where Brian Urlacher came right out and said that he would never turn himself in for a mild concussion because he wasn't going to miss any playing time. 1/3 of athletes do not recognize their symptoms as a result of concussion. Even athletes who get knocked out don't understand that it's a concussion. Over 70% fail to recognize the fact that when you're knocked out that you've had a concussion. And another reason athletes don't recognize they're concussed is when they get concussed, their cognition is impaired, so they truly don't realize they have a concussion. They're being honest with you when they say they don't think they have one. So what are What are other predictors for prolonged recovery? Age has something to do with it. As I said, teenagers, preteens tend to take longer than young adults. Gender has something to do with it. Young ladies take longer than young men. And then pre-existing conditions. There are numerous studies that suggest collegiate athletes get well within 1 to 2 weeks, but young athletes, meaning high schoolers and junior high schoolers, take considerably longer. Dr. Collins out of the University of Pittsburgh Medical Center in 2025 found that 25% of high school players took up to 4 weeks to reach full recovery. A study done in Philadelphia found that neuropsychological testing, how many of you folks are familiar with the impact test that we do, it's done here at Hanover Central? That's neuropsychological testing. There are a number of brands out there. There are other brands besides Impact, but the fact is that 90% of the schools that do use a neuropsychological test use Impact. So that's the most common one. High school athletes recovered significantly more slowly than college. So it indicates a need for age-specific guidelines. So we really need to be more careful with our high schoolers and junior high kids than we do necessarily need to be careful with college age and young pros. Question?
Do you think that's because the college athletes are more managed?
No, I think their brains are more mature. The frontal lobe of the brain is the last part of the brain to myelinate. And that myelin sheath on the brain cells offers a level of protection that isn't there, and the brain is relatively developed by the time you're in your early 20s, as opposed to a teenager whose brain is subject to all sorts of crazy chemicals. And their brains are not made to take a hit the way a young adult's brain is made. I would say to you there are a lot of high schools that manage concussion much better than some colleges, based on the experience I've had with both. Now, I get kids that come back from college from high-power programs, and the pressure is on. You got to play. Here's an interesting study that was done in 2014 at Children's Hospital and clinics in Minnesota. They found that school being in session versus summertime, that recovery took twice as long during the school year from concussion than it does during the summer. Why? Because there's increased cognitive activity during the school year, and there's the stress of missing school or not doing well in school. So you have the cognitive stress of trying to do schoolwork, and then the stress that the student puts upon themselves being worried about missing school, and you really have to balance that. Why does it take time to recover from concussion? I'm not expecting you to remember the details of this graph, but I hope you get something out of it, and I'll explain it as we go along here. In the moments or the minutes after a concussion, and you can see, like in the first 4 minutes, you have this immediate disruption of neuronal membranes resulting in a massive efflux, meaning migration out of the cell of potassium into the extracellular space. So potassium goes rushing out of the brain cell at the time of concussion. And this happens within the first 4 minutes. And this results in a calcium-dependent release of excitatory amino acids, particularly glutamate, which stimulates further efflux, meaning more potassium goes out. And you need potassium in the cell to run cellular functions. And then the biggest problem is cells want to keep charge and balance. So if a positively charged ion goes rushing out of the cell, some other positively charged ion needs to come in. And unfortunately, in this case, that means calcium. Calcium goes running into the cell, and it really gums up the function of the cell and slows down the speed at which the brain cell can work. And if you look at that graph, you'll see that calcium stays in the brain for, instead of minutes, it stays in the brain for days. And until all that calcium and potassium gets back in balance, where the calcium is outside the brain cell and the potassium is back in, until all that chemistry is fixed, the cell can't recover, and worse, is more vulnerable to further injury. Dr. David Hubbard at UCLA in 1991 did the study that produced that graph I just showed you.
Is that a function of the cell being damaged, or the cell trying to protect itself?
A little bit of both. The cell is damaged. The cell membrane gets stretched, so there are natural pores in the cell membrane, now they're stretched and opened larger. So that's part of it. And the cell now, if the cell isn't killed, the cell needs to repair itself. And if you continue to stress that cell, the cell may die. But Dr. David Huckler, who produced that graph, he's still at the University of California, Los Angeles. He studied concussion at the neuronal level, looking at neurons, and he found that twisting and stretching and compression and shearing of the cells when a concussion happened. How did he figure this out? He took little hammers and hit little rats in the head with his hammer. And he discovered, and it seems to be the chemistry is about the same in rat brains and human brains in terms of time. You have this increased vulnerability to re-injury during the acute recovery period, which in young adults is 7 to 14 days. And he postulated what we call a metabolic mismatch between the brain glucose utilization and cerebral blood flow. When you have a brain with normal chemistry, here's normal chemistry, here's normal blood flow, they're in balance. When the brain gets a concussion, the chemistry goes crazy. Make sense? Anywhere else in your body, heart, lungs, liver, if you get a bruise in your thigh, sprain your ankle, at the most basic level, even a sprained ankle is bad chemistry. And what's the body's reaction to the bad chemistry? Send more blood there to fix it. That's why your ankle swells. Not in the brain. The body knows the brain shouldn't swell when it gets hurt. Because if the brain swells, it'll crush itself up against the inside of the skull. So the body's reaction is, here's all this crazy chemistry, normal blood flow, cut the blood flow in half to protect itself from swelling. So now you have what we call a metabolic mismatch. Bad chemistry, no blood flow to fix it. So, preventing prolonged recovery, immediate recognition. We need to recognize concussions as soon as possible. That means immediate removal from the game or practice. And that also means not watching the remainder of the game or practice. That athlete needs to go inside. Do they need to go in a dark room? No. But they do need to go into the quiet locker room. Sometimes they need to go to the emergency room. So what are the criteria for needing to go to the ER? Well, if they're knocked out for a minute or more, definitely to the ER. If they have a worsening headache instead of an improving headache, ER. If their consciousness level is fluctuating, if they're knocked out briefly and they wake right back up and they stay awake, terrific. If they wake back up and start to fade out and wake up and fade out, ER. If they're increasingly confused or irritable, if they have any numbness in their arms or legs, if there's repeated vomiting, if they vomit more than once, if they suffer a seizure, which is very rare with concussions, but does happen, if they have slurred speech or the inability to speak, and I've seen that plenty of times, go to the ER. And then finally, if they have inability to recognize familiar people or places, when an athlete does not recognize mommy, I have no trouble convincing mommy to take that athlete to the ER. There's nothing that scares a mother more, and I probably see it about once a year where that athlete truly doesn't know who mother is, or dad for that matter. So, continuing along that vein of preventing prolonged recovery, we like to recommend taking at least 2 days off right after a concussion. And that also means no driving. And there's actually was a study published back in June of 2015 that showed why you shouldn't drive for at least 24 hours. Some people probably shouldn't drive for as long as 2 weeks. No non-steroidal anti-inflammatory drugs. No aspirin, no Advil, no Aleve. Aspirin is a major blood thinner, so if your athlete's got a concussion, or actually now it's something a little worse than a concussion, but we don't realize it yet, it has a little bit of bleeding inside the brain, giving them aspirin will make them worse. And the other non-steroidals, such as Advil and Aleve, they are also mild blood thinners, and in general, the non-steroidals slow down recovery. They may take your headache away, but they slow down your recovery. So the recommendation from the National Athletic Trainers Association position statement published in 2014, which was written by physicians and athletic trainers, including Dr. Bob Cantu from Boston University, the only pain relief medication you should use at first is acetaminophen or Tylenol. And then from that point forward, we need to properly manage their return to school, work, and play. Moving on to concussion in the classroom, we're supporting the athlete's return or the student's return to the classroom. And if we do it right, we'll prevent a prolonged recovery. When we speak to an athlete or anybody that suffered a concussion, we first want to find out about their developmental history, particularly if they had speech or walking delays. We want to know about their academic history, particularly if they have a learning disability or ADD or ADHD. We need to know about medical history, including previous concussions. We want to know about family history of migraines, seizure disorder, dementia, and other unusual neurologic disorders. We want to know about the patients and their immediate family psychiatric history, and we want to know the exact mechanics of the injury. The first treatment recommendation is education. We really need to stress to both of the parents and the athletes the whys and wherefores of concussion. And then the next thing we want to do is we want the athlete to have relative rest, doing things that don't make the symptoms worse, and probably in those first 2 days, no school and no practice. Limited cognitive exertion, that does not mean complete isolation or complete inactivity. That will drive the young man or young woman crazy. You need to monitor the physical symptoms and intervene when appropriate, particularly if they're having troubles with dizziness. And then you need to make academic and work accommodations. Academic accommodations such as excused absences, full or part day. The same principles apply with somebody who's working. They may need rest periods during the school day. Something that really helps is extended time to complete assignments, allowed to take a test over 1 or 2 periods, 1 or 2 days, and instead of trying to get it all done in one period. One thing we really recommend is no more than 1 test per day. I think a lot of kids can handle 1 test per day after a concussion. You have them take 2 or 3 tests in the same day, like at finals time, and you're asking for prolonged recovery. And if possible, use of smaller and quieter exam rooms. Seat them away from windows or loudspeakers.